is the continuation of our clinic tour. And today I'll be taking you to our embryology lab. This is where the magic happens. This is the powerhouse of the IVF treatments. Come with me as I take you inside. Hello. Good morning. Okay, please, could you kindly introduce yourself and briefly, I could see a lot of equipment here, and briefly tell us what happens here.
Okay, my name is Idris. I'm an embryologist, and with me here is my colleague, Mr. Aloy. He's also an embryologist. And I call this place one of the powerhouse of a fertility clinic. And I know you're seeing a lot of equipment and you're wondering what they do. So I can just take you around and tell you what they do. So here, if you would like to see this, this is a flow hood. This is a flow hood with two workstations. So with two stereosome microscope. This is a workstation with two stereosome microscope. And we have a monitor for you to be able to see what you're doing. While I'm doing something here, you can easily see what is happening, and others can also see, and we can also make a decision. So this helps us to have a contaminant-free environment. So we do most of oocyte pickup here. We view the embryos, the oocytes, and all that. So this is where we do that. And you can see it's at room temp. It's at 37 degrees centigrade. You can actually set it to the desired temperature that you want to work with. So sometimes if you want to have a room temperature, you can set at room temperature. You can have it there. And this is a test tube warmer. What this basically does is it warms your test tube at the desired temperature. You can set it at the desired temperature. If it's 37 you want it to be, so that you can always have your follicular fluid or whatever it is, your media, at the desired temperature that it's supposed to be. So here we have an air filter. This is an air filter that helps us to reduce the VOCs. We're trying as much as possible to have 99.9 VOC free. So we have this that helps us to take away VOCs, filters the hair. We also have all these incubators. We have four different incubators, two binders, and two of CO2 cells. They are the same. They are all CO2 incubators. And why we have all this is because we sometimes have culture. When we have culture here, we don't want to touch embryos that are already in the incubator. We have other things to do. We can use other incubators, just power them up and use other incubators. And again, why we have more of these incubators is just because, should in case we run into trouble, one incubator is not working, we can't be running here and there. We just quickly switch on to another incubator and we have them. So you will also want to see our centrifuge. Is an high It's a very good centrifuge, and this is G-stem centrifuge. So this is what we use for our andrology, and we have a sperm microscope. This is a binocular microscope, and we also have a sperm meter. We have a sperm meter for semen analysis. So, and with me here is our EMR, electronic record, medical record. These are our electronic medical record where we keep all records of all we do, from egg collection, patient name, number of embryo, number of oocytes retrieved, embryo grading, oocyte grading, number of embryos transferred. If you have freezing, if you have embryos that are left over that we want to freeze, we have all the records of each patient here. So here again is a system that is connected to the ICSI machine and also connected to the laser. So whatever we are doing here, we can project, you can see it here for people who want to learn. If you want to learn or you want to also see what my colleague here is doing, you can easily just watch and see what he's doing. And we can also look at it together and say, okay, this is a decision. We can make a decision together on this. Here is our ICSI, intracytoplasmic sperm injection machine. My colleague here is just trying to set up for an ICSI, just trying to setting up his needles and all that to prepare for ICSI. So this is an intracytoplasmic sperm injection machine. For what this basically do is just picks one sperm and one oocyte, just one egg, one sperm, and injects the sperm into the egg for possible fertilization, and we proceed for culture. So there's this small guy here, this small equipment here. It's looking very small. I call it small but mighty. This is an RI Saturn 5. It's a laser. What it just does, it helps. We use it for AH, that is assisted arching. There are times when you have embryos with thick zonae. When the zonae is thick, they may not be able to arch out. And these are some of the reasons why you have failed implantation or failed cycle. Sometimes you have good embryos, you have generated good embryos, but the embryos are refusing to, are failing to arch out. So we can quickly just use this, bore a hole somewhere around the embryo, and it helps to arch out. So we can also use this to isolate cells from an embryo for our PGT, PGTA, PGTM. We can just use this. It helps also to also cut out a few amount of cells, just maybe 5 cells or so, from the entire blastocyst, and we can send them out for analysis. So this is a coda air, a coda arrow. It's also a VOC remover. You can see here the VOC remover. So it also helps to filter the air and takes away VOC, trying to have as much as at least 99.9% of a lab that is free of VOC. So that is basically all we have here. But though we still have some little equipment. I may not be able to bring them out all to show you. We have so many other small equipment, but these are the visible one that you can easily see. And I think these are just what we have for now. We also have our cryo tank, where we have our storage tank, where we do all our cryopreservation, sperm freezing, egg freezing, oocyte embryo freezing. We have it just at the back there. So that is basically all we have here.
Okay.
Thank you.
Thank you so much. Thank you so much. So much to learn. So much to learn. Hope you're learning because I am too. I am too. Okay, so right now, we're gonna be answering frequently asked questions like, how do I start my fertility journey? So right now, we're helping us with that is going to be we're going to be meeting with our metron, who will be telling us, or rather educating us on the steps to take, the steps to follow when you want to start your fertility journey. Come with me. Hello. Hello, Nurse Chidima. Okay, please kindly introduce yourself and tell us how, like, someone or a couple that want to start their fertility journey or treatment, what are the necessary steps to take on that?
Okay, thank you very much. My name is Nurse Chidima. I'm a registered nurse. And from the question being asked, how the steps to take while when you want to start fertility journey. First of all, if you're coming in as an individual or as a couple, the first step is taking that decision. The first is taking the decision. As an individual, you have to decide this is what I want. I want to go in, I want to do an IVF, I want to have my own baby. Then, as a couple, you have to sit down with your partner and agree that if you want to venture into this journey and you want to have your own baby. Because it's not all about getting financially ready that is required in IVF. Your psychological being is of utmost important in us because it's going to help you achieve and maintain pregnancy. So first step is making that decision. Once you make the decision, the next is, where do I go? Then when you come in into the clinic, you'll be able to access care. First of all, you see a doctor who takes down your history, does some examination. This will help to narrow down or find out what actually is causing infertility in that couple. Is it as a result of male factor, female factor, or any other thing? That will also guide their treatment. Once the assessment is being done, it will help in making decisions. Do you need third party assistance? That is after the investigation and the history. That is when such will be determined. Because before now, people see that issues with infertility has to do with women, but that's not true. Both women and men, both women and men contribute equally to infertility. So have to know today that science has made a lot of things easy, and it's no longer only the women, because before now, women are being stigmatized for not even having a child, even when the man, the problem on an unprotected sex for like 3 or 6 months, and you're not able to achieve pregnancy, that is infertility. Or less than 35 years and have enough exposure to sexual unprotected sexual intercourse, and they have not been able to achieve longer, start taking steps. All those science or all those procedures, all those treatments available is still God that provided those individuals with those knowledge, and they provided it to us so that to make life easier and not to hunt down anybody or stigmatize any individual that he or she is the cause of why you are not having a baby. So get up today, make that decision, sit down, discuss with your partner, and take the decision of going to seek for help. I hope this has answered your questions. Thank you.
Okay, thank you so much, Nurse Chidima. That was really wonderful. I hope this has answered your questions, like she said. So feel free to chat us up. Feel free if you want to learn about your IVF treatment or you want to speak to our fertility specialist. Feel free to send us a message, or you